All right, Fox 5 Health News. Could injections of so-called young blood help Alzheimer's patients?
Joining us now is Fox 5 medical contributor Dr. Devi Nampiaparampil. Good to see you.
Good to see you too.
All right, so this is what, a team of researchers out of Stanford University?
Yeah, they looked at about 18 patients. These are patients with Alzheimer's disease, and they transfused them. So they gave them blood from younger patients, healthier patients without Alzheimer's. And so their thinking and memory didn't change, and it is a small study, but there were some signs, at least from the caregivers, that these folks were more engaged. They were more talkative. They seemed to be a little bit better, more perky from receiving this blood. Now, to be fair, sometimes if you get a blood transfusion, you might be more energetic because you're getting some of the components of blood that you just carry oxygen better. But this was a specific type of blood transfusion, so it was only the plasma, not the red blood cells that carry oxygen, not the white blood cells that fight infections, and not the platelets that help you to clot. So it's basically sort of some of the enzymes, just sort of like the background water, essentially, in your blood.
Like
so
the coconut water of the blood.
Exactly, exactly.
Yeah.
So, you know, so it raises some questions. It's a small study, so we don't know for sure if it's reliable in that sense, right? But it also makes you wonder if there's something in people's blood that helps fight Alzheimer's. So there was another study that came out about a week ago. This was basic science with animals. So they surgically joined mice, which, you know, we can debate about whether that's appropriate or not, but, you know, surgically joined mice, they found that if one had Alzheimer's, the other one actually could develop Alzheimer's from being connected, physically connected to the other one. So there might actually be something in the blood that makes a difference here.
Interesting. All right, very well.
Okay. I'm trying not to imagine that. Medical marijuana wins the support of the largest veterans organization in the U.S. Yeah, we've heard a lot of talk about it perhaps being beneficial.
Beats being addicted to pills. I mean, you know, right? That's the argument.
Absolutely.
Yeah, so I agree. I actually worked at the VA for several years with veterans, especially, you know, veterans tend to have a higher incidence of a lot of things, post-traumatic stress disorder, other anxiety disorders.
Right.
Yep, so you have issues where, you know, there's a lot of use of benzodiazepines, which can be deadly. Then you have also a higher incidence of chronic pain and more use of opioids sometimes. And then plus, you know, some of these other things we see like traumatic brain injuries and stuff, right? So with the medical marijuana, the idea, this was a survey, nothing has changed, but they're actually looking to see would people be in favor of the research. I can't imagine anyone not being in favor of researching this. Yeah, so not that people should necessarily get it, but at least look to see if it might make a difference. It might be less harmful. It might have some other, you know, beneficial effects, but I think we have to still be a little bit cautious because, you know, you have patients who are sicker, maybe with more medical problems, and could these things interact, of course, you know, with the medications they're already getting. But anyway, so a couple of things that were interesting is that they said that 1 in 5 veterans are already using marijuana for medical purposes, and a lot of these folks aren't the younger folks that people traditionally think of, but people over 60. So a lot of room to be able to kind of test the possibilities.
People have been using pot for a long time at this point, right? It's
For medicinal reasons, even that.
Yeah, for sure.
I don't know if that's what you meant, but thank you so much,
Gotcha.
Doctor.
Thank you, Dr. Devi.